Hello and welcome to today's session. After successfully calculating the total burn surface area, we are now supposed to calculate the amount of fluids we need to administer to a patient who has sustained burns. Okay, and the easiest formula that we normally use is the Parkland formula, and this is a mathematical formula that is used to calculate fluids for resuscitation in burn patients during the first 24 hours. Okay, so the aim of it is to ensure we have adequate fluid replacement to prevent hypovolemic shock and maintain proper tissue perfusion. This formula helps guides healthcare providers in determining the volume of fluids, usually the intravenous fluids, that a burn patients need to receive in order to stabilize their condition and support the healing process. So the Parkland formula is normally calculated as follows, and this fluid is in milliliters. Okay, so you take 4 mils times the body weight in kilograms times the total burn surface area. Okay, so where is 4 coming from? So the value 4 in the Parkland formula is used to represent the amount of fluid replacement required per kilogram of body weight for each percentage of the total body surface area. Okay, so this value is based on the empirical observations and clinical experience, and it reflects the estimated fluid loss and metabolic demands that occur following a burn injury. So the formula deprivation is based on the understanding that the burn injuries lead to increased fluid loss due to factors such as increased capillary permeability, tissue damage, and evaporation from the exposed tissue. Additionally, burns can trigger a systemic inflammatory response that increases fluid requirements to support tissue healing and maintain proper organ function. Okay? So the third one is the body weight, and the weight should be in kilograms. If you have weight in pounds, you can simply divide it by 2.2 to convert it into kilograms. The total burn surface area is the percentage of the patient's total body surface that has been affected by burns. In an emergency situation, we normally use the rule of nines, where you can easily calculate the burn surface. Remember, a link will be popping up on how to use the rule of nines to calculate the total burn surface area. So once you have gotten the amounts in milliliters, okay, 4 times body weight times the total burn surface area, you're supposed to divide the fluid into two portions, where a half of it, of the calculated volume, is normally administered in the first 8 hours following the burn injury, whereas the rest, or the remaining half, will be administered over subsequent 16 hours. Remember, this fluid is supposed to be given for 24 hours. First half in the first 8 hours, and then the remaining half in the subsequent 16 hours. So that's how we use the Parkland formula in estimating the amount of fluid the patient should be given. Thank you so much, and you can access the free quiz in the description section. Thank you.